With that, I think we'll go ahead and get started. Just want to welcome everybody and thank you so much for joining us. I'm Kate Trams and I work with the National American Indian and Alaska Native Addiction Technology Transfer Center. And I also work with Jeff LaDolter, who you may know. You probably already chatted with him a little bit or heard about this through him, and he is the program manager for the TOR Technical Assistance Grant. So for any technical assistance questions, you can find his email in the screen under the contact and support. A little bit further down, since there are these instructions that we have for the webinar, which I'll want to go over really quickly today. So the reason we have we're asking you to do a little bit different setup for connecting to the audio here is so that we can have a little bit easier time when it comes to the Q&A. And this should help the process go much more smoothly if we can have everyone follow these instructions. So if you are listening to us through your computer speakers right now, if you can wait until I get through this. Actually, you won't be able to hear me give the rest of the instructions before you, if you start by muting your speakers. But if you follow these steps 1 through 4, then you'll be able to, we'll be able to easily unmute you at the Q&A time when you use the raise your hand option. For those of you who have called into the conference line, you can do the same thing by first hanging up your phone and then following the instructions 2 through 4, and you would have the same option available. So it'll call you, and that way we will see, we will know who is actually requesting to have the audio rights to ask a question. So I'll just walk through this really quickly. So after you would mute your speakers at that green icon up at the top menu bar, or if you're on the phone at the moment, you can hang up. Then you would go up to the phone icon and click the down arrow and select Connect My Audio. Then when the options pop up, you're going to choose Dial Out and then enter your phone number and click Join. Then the conference call will actually call you, and you can just answer your phone and it will prompt you to dial 1 to join the meeting. And then we will have you muted for the time being during the presentation, and then when it comes time for Q&A, the option to raise your hand is there, and that's just next to the phone icon at the top. And you can choose that, and then we can identify people one at a time to ask questions, and we can address them. So I want to thank you all so much for joining us and for walking through this. And so I'll give everybody a minute to make that change and switch over now if you can, and follow those steps while I pull up Dr. Thundercloud's slides, and then I'll pass things over to him in just a moment. And sorry, if you still need the instructions, they are also written out in the contact and support box below, and I'll put those in the chat box at this time too. Okay, it looks like there are people who are calling in, so I just want to give everybody another minute to make that change and to get set up here. Okay, well, I wanted to just welcome Dr. Thundercloud. Dr. Alec Thundercloud is of the Ho-Chunk Nation, and he is the director of the Office of Tribal Affairs and Policy. And I'm so glad that we get to have him here with us today, and he is going to be giving you all lots of information about your grant. And so I want to pass things over to you at this time, Dr. Thundercloud. Thanks so much.
Hi, Kate. Good morning in Alaska and over on the West Coast, and good afternoon to other folks. This is Alec Thundercloud. Thanks. I want to thank the American Indian and Alaska Native Technology Transfer Center for hosting this call for us on the program monitoring and performance reporting for the Tribal Opioid Response Grant, and I want to thank all of the conference members for attending and joining this call today. As you're aware, I'm the director for the Office of Tribal Affairs, and our office serves to support and provide the resources necessary to maintain and improve the behavioral health of American Indians and Alaska Natives throughout Indian country. Our office is tasked with being the primary point of contact for tribes, tribal organizations, and Indian health programs and other stakeholders on issues related to behavioral health. And we lead and support SAMHSA-wide efforts to improve behavioral health and tribal community issues in the arena of mental health and substance use disorder. In addition, we help coordinate tribal consultation, outreach, education, and engagement efforts, as well as participate with our Tribal Technical Advisory Committee comprised of representatives from the 12 IHS areas and 2 ad hoc members from our advocacy organizations. Today we have Dr. Darren Fulmore from the Center of Behavioral Health and Statistics and Quality, who will be our presenter on the program monitoring performance tools. And on this slide, you will see that we have 2 grant project officers, William Longetti and Amy Romero. They're covering currently all of the regions within IHS. However, we are in the process of hiring a 3rd GPO who will be covering those states. But in the interim, you'll notice that William and Amy will be covering all of the TOR grantees. So if you have any specific questions, you may contact them based on the region or the state that you see there in which your program is located. And with that, I'll hand it over to Dr. Fulmore.
Thank you, Alec, and good afternoon and good morning to all of you. Again, this is Darren Fulmore. I'm from the Center for Behavioral Health, Statistics, and Quality. I act as the lead for the system that collects your grant performance data, otherwise known as SPARS or SAMHSA's Performance and Accountability Reporting System. Catchy name, I guess. So today I'm going to review the TOR reporting requirements, starting at a high level and working down to the specifics. And throughout the presentation, depending upon when you join, I'll pause because our meeting coordinator may provide some detail on how you will be able to submit or ask questions. So to that end, as you see our agenda here, we'll start with an overview of the TOR program itself. And I'll talk a little bit about the program monitoring performance, specifically SPARS. I'll get into the why we collect this information, the Government's Performance Results Act, or GPRA, and the accountability as a result of that policy. And then I will get into more detail about your program or grant level requirements. And for those of you who are collecting client level data, I'll review the GPRA tool. Finally, I will show some examples of some reports that you can run on your own so that will assist in you monitoring your own programs, and examples of trainings and other kinds of technical supports that can assist your program in being successful. And so TOR, what is TOR? So this program aims to address the opioid crisis in tribal communities by increasing access to culturally appropriate and evidence-based treatment, including medication-assisted treatment, or MAT, using 1 of 3 FDA-approved medications for treatment of opioid use disorder. The intent is to reduce the unmet treatment need and opioid overdose-related deaths through the provision of treatment and/or recovery activities for OUD. And then finally, this program supplements current activities focused on reducing the impact of opioids and will contribute to the comprehensive response to the opioid epidemic. Okay, so there are additional expectations as a result of SAMHSA's funding. So SAMHSA expects that grantees will provide and develop opioid misuse prevention, treatment, recovery support services for the purposes of addressing the opioid abuse and overdose crisis within your tribes. TOR is one of several SAMHSA Services Grants programs that intends on providing services to impact this crisis. As you know, there are key personnel, specifically your program director, that SAMHSA must approve prior to the execution and development of the service provision. There are a few funding restrictions and limitations. Specifically, grantees can use up to no more than 25% of their total grant award for data collection and performance management. Again, only FDA-approved products can be used for TOR funds, and these funds may not be expended through the grant or subaward by any agencies, which would deny any eligible client, patient, or individual access to their program because of the use of these said FDA-approved drugs. So now I'm going to get into where we report this information. So if you're not already aware, SAMHSA has a very extensive performance management system known as SPARS. And so SPARS is SAMHSA's consolidated and centralized data repository. All SAMHSA grantees, or nearly all, report into SPARS, and that includes our Center for Mental Health Services, Center for Substance Abuse Treatment, and Center for Substance Abuse Prevention. Each center uses SPARS to assist with program monitoring. It was developed so that grantees and GPOs in SAMHSA writ large can take a more uniform approach to supporting our grant programs and assist with quality improvement. Here's a screenshot of roughly half of the home page for SPARS. So we pause there for a moment and just talk about what you see. So if you're a grantee and you see this home page, you don't need to have a SAMHSA account to look at some of the resources available on the home page, and that includes the tool that most of you will be using to submit your GIFR data. So across the top, you have the home page. You have data entry and reports, training, technical assistance, and help. In order to access and enter information, that's when you would have your account, and we could talk a little bit about that later. In addition to that, there are some pre-recorded trainings that are available to grantees. In addition to that, there are many different ways for requesting technical assistance for program monitoring and data support. So, so this slide shows all the different ways that grantees can use SPARS. And so as I said, you can submit your information once you have an account. We'll talk about ways to generate reports and what that might look like. There are resources that you can access on the public-facing site. That includes, but is not limited to, the tool itself. There's also a frequently FAQ. And then we also have a Q by Q. That's a question-by-question guide. It's a very extensive document, and it walks through all the questions on the client and grantee level tool, answers many of the questions, including how certain questions may be interpreted, or where you can get additional support if there's still questions you may have. This page here, this is the Data Collection and Tools Resources page. This is on the home site. You do not need a login or a SAMHSA account. So if you're hiring staff or onboarding and you want to download or share the tool because it is OMB approved, it's a public tool, you can click on the far left where it says CSAT, where the tool is housed, and you will see the client level tool there. You'd also have access to the program level tool where you report on, or if you're distributing, purchasing, or distributing naloxone kits. And here's the information for contacting the help desk. As far as help desk, may be contacted between 8 a.m. and 7 p.m. Eastern Time. You can do that by phone or by email, and typically they respond fairly fast. If there's an account lockout issue, in most cases you won't even need to contact SPARS by email or by phone. You could do a password reset, you get a link, and you can re-enter or develop a new password for yourself. So now I'm going to talk about the why. I mentioned earlier that you've got the who, that's the TOR grant program. You got the where, that's SPARS. I want to talk a little bit about why we have the requirement to collect and submit program or client level data to SAMHSA. So the law that everybody knows, we say GPRA, but it stands for the Government Performance and Results Act. There are two laws. First, in '93, and essentially the government said, we need a way of centralizing and having a standardized way of collecting performance and measuring and monitoring the programs that we fund. So they enacted this law so that all federal agencies can keep track and show stewardship of public funds and resources. This law was updated in 2010, built upon lessons learned, but added additional requirements, including increased accountability, force or require federal agencies to do more in terms of program performance, to discuss in their findings ways to highlight effectiveness of programs that are being funded, improve service delivery, and also improve congressional decision making. In other words, we want to know how you're spending your funds, so you got to report up to us. And then finally, improve internal management, and that goes into how your GPOs and how your opt-ins, that would be SAMHSA in this case, is using the GPRA data to help improve the programs that we're funding. This is just like an overview of the different treatment programs funded by SAMHSA, but what I wanted to highlight are the opioid programs, where SOAR and TOR, the state opioid response and tribal opioid response grantees, kind of fall. So we have our MAT-PDOA, that's a Medicaid-assisted therapy, prescription drug opioid abuse programs. We have our rapid cycle opioid, and those were the strategic, those are at the state level. Some of you may have even been awarded these funds. And finally, we have our SOAR and our TOR program. So some of you may be familiar with some of these other grant programs I've listed. I want to give you an idea that SAMHSA is very committed to addressing the opioid crisis, and we tackle this in many different ways and funding streams. So I'm going to go a little bit more detail about your data reporting requirements. So to start off, all TOR grantees are responsible for reporting program level data. And essentially, that means that we want to know that if you are intending to purchase and distribute the naloxone kits. And if it's a no, we want to know that's a yes. We want to know that as well, in addition to how many you purchase and how many that you distributed. Only grantees that are providing direct client-level opioid misuse treatment and recovery support services are required to complete the giver client level tool. And then finally, SPARS does have the capacity for grants to report via batch upload. Typically, these are grantees that have some kind of electronic health record. If this is something that you've had thoughts about or need additional questions or concerns, feel free to reach out to your project officer, and my information will be also provided at the end of this discussion. I'm going to pause there a moment because I think, again, we may have had some people join, so I don't know if the coordinator wanted, again, to relate the information about how to submit questions.
Thank you so much. Just wanted to let people know that we are going to try to do a little bit more interactive audio for the Q&A portion of this. So if people can follow, I'm going to put 4 steps in the chat box right now to follow to connect your audio for today, and that way you'll be able to give your questions to us, and we'll be able to unmute you individually, and this will just hopefully be a little bit easier process for everyone. So I'll put that in the chat box right now. Thanks so much.
Okay, thank you. All right, so we can go on to the next. Okay, so again, getting a little bit more specific about your reporting requirements. I mentioned earlier, grantees providing direct client treatment or direct recovery service will be required to report using the client level GIPRA tool, which is available on that data collection tool webpage that I indicated earlier. This data is going to be collected using SPARS. The third bullet talks about the program level and client level. So the program level, as you may already know, is collected quarterly. So for example, 10-1, so quarterly on the fiscal year. So you have 10-1, I think you have 1-1, 4-1, 7-1, and 10-1. And you have about a month to report whether or not you are intending to distribute kits, yes or no, and then in addition to that, how many that you purchased and how many you distributed. I mentioned earlier you can use up to 25% of your award for data collection and performance assessment. So I mentioned this earlier. This is a requirement, the program level questions, and there's just 3 of them. That's all TOR programs where we really want to know whether or not you are intending on distributing kits. And so the answer is no, you have met this requirement for that quarter. If it's yes, you've met that requirement, but you'll have 2 additional questions. And so when you get your SPARS account and you log in, the screen will look like this. So you log in, you click, and you see on the left, it'll say either services or program. Program in this case is where you report on your kit distribution, if you're intending on doing that. And then the questions you see on the screen, there are 3. You report if you're doing it, what quarter in the year, the 4 quarters I mentioned earlier, and then if you purchased them, and then how many. And then you hit submit, and that's it. You've met your requirement for that quarter. And then you would get reminders as your time for the next submission approaches. So for the client level questions, and again, we mentioned this earlier, this is for those that are providing client level services, you have reporting periods. The intention is that you would meet 100% of your intended goal. So depending upon what you have stated or to your GPO or in your funding announcement, baseline is essentially 100%, whatever that target is. 6 months later, you will report your follow-up information, and then there's discharge. And discharge doesn't necessarily need to happen 6 months later. It can happen in between baseline and 6 months. But essentially, at discharge, you are reporting, and I'll indicate this later, your service provision. There is a minimum requirement of 80% at follow-up. Once grantees are provided access to SPARS, if you don't already have a SPARS account, you will be able to go in and start to enter your information. So here is a bulleted list of the sections of the client level tool. So at section A, this is your essential background information. This also includes behavioral health diagnosis. Earlier this year, we made a major change to the client level tool, adding a number of ICD-10 codes, diagnostic codes, because SAMHSA really wants to know what is the population that you're serving, and we want to make sure that the clients that you've targeted as well as diagnosed, we want to make sure that we are appropriately treating those clients. Planned services would be where you would indicate what you intend to provide in terms of client-level services. In addition to that, there's some basic demographics, everything from age, ethnicity, those kinds of things. And then finally, if relevant, any military, family, and/or deployment data is indicated here. Section B, this would be the beginning of what we call our national outcome measures, or NOMs. So here there are a series of questions about past 30-day drug use and/or alcohol use. Section C includes items related to family and living conditions. D, education, employment, and income information is entered here. E, any crime or criminal justice status that will be relevant. Section F is mental and physical health problems that are reported by your clients, in addition to any treatment, recovery, violence, or trauma. And finally, Section G relates to social connectedness. Those sections are entered at baseline. Once you are ready to do your 6-month follow-up, you go into SPARS, you will have an additional section to complete, that's Section I. If your client is being discharged, then you would enter sections J and K. K would be services received. And that's very important because we use that to relate back to your initial intake, where in sections A, you entered information about planned services. So again, I want to talk about the baseline. So I mentioned that your baseline, 100%, so of whatever target you have. And that tool would be, the tool we have will be, again, used at all 3 milestones: intake, 6-month follow-up, and discharge. Interviews should be conducted face-to-face, but we understand that there are exceptions, and if that's the case, or if you need one, that's something you'd want to discuss with your project officer. I reviewed this earlier. For the baseline, sections A through G are completed. Sometimes clients do return for a new episode of care. This happens frequently, and for clients are using substances, you would still use the same client ID. So the one thing that would change would be the episode of care date. And again, for baselines, the expectation is that you would report on 100% of your target based upon the funding of your program. Again, I mentioned earlier, follow-ups, you would complete the same sections as baseline with the addition of sections I. If you have to conduct an administrative follow-up, in rare cases where you are unable to find your client, or they're unwilling to do the follow-up, there is an administrative follow-up option where you would complete sections A and I. And as mentioned earlier, the minimum follow-up rate is 80%. And again, sometimes we understand that administrative follow-up may be necessary. Discharge interviews, again, like the baseline, you'd enter sections A through G. You would not do I in this case, but you would enter J and K. J is essentially the discharge information, and K, as indicated earlier, was services received. We have also an option for an administrative discharge in cases where the client is unwilling or unavailable, and you would enter the sections A, the records management, and still complete sections J and K where indicated. a little information about SAMHSA's discharge policy. If for whatever reason the client is discharged and there's some level of inactivity, you're unable to locate, again, it indicated that you do have the option for the administrative discharge. Apologize for the blurry screen. I just wanted to give a sample shot of the paper version of Section A, the beginning of Section A on the GIPRA tool. So it look a little like this, and can be completed by hand, and or if you have a tablet and you've logged in the SPARS, you can complete the client interview basically in vivo. You can do it right then and there on demand. So it depends on the resources of the grantees. Some additional information here. I mentioned earlier that this year we added diagnostic information to our GIPRA tool. So again, this is SAMHSA was very interested again in finding out, not just demographics, age, ethnicity. But in addition to that, we want very detailed information about the appropriateness of the services that are being provided. And we'll know that directly or indirectly by the diagnostic information we receive from grantees. Again, some additional screenshots of how the tool looks. Sections A, again, records management. And again, I've reviewed this, but I'll go through it again slightly quickly. It's Section B, again, past 30-day use of drug and alcohol use. So that'd be Sections B. Section C, you have your family and living conditions. And again, these questions pertain to the past 30 days. And as mentioned earlier, Sections B through G that we're going to talk about briefly are the beginnings of the national outcome measures. Sections D will pertain to questions about attendance at school, grade level completion, and again, this is depending on the age of the client. Some of these questions may or may not apply. E, these are the criminal justice status of the client. And again, depending upon the status, there are questions related to being able to refuse the item, or it's in A. So sometimes we get questions about the appropriateness of the items. There are options for that in these sections. Sections F are the mental health and physical health problems the client may report, in addition to any violence or trauma items. And then finally, Section G, that is social connectedness, and essentially what the client perceives as their social network, family, friends, those kinds of things. And again, Sections B through G, those are required at all milestones. That's baseline, intake, and follow-up. Sections I, this is at your 6-month follow-up. And again, you enter Sections A through G, and then you would do I. And then there are questions here that will be asked by the grantee, the interviewer, to the consumer. There are some administrative questions as well. And when completing the discharge interview, you do not do Sections I, you will complete Sections J. In Sections K, this is completed at discharge, and the very important items here would be the sections about what services were provided, and it's kind of the bookend to services planned. There are some questions here that we want to make sure that we get and that are completed by the grantee, and they're not asked to the client. So again, this is a review of the follow-up interviews discussed earlier. So again, make sure you complete Sections A through G, Sections I, you have your follow-up, that's your records management, if you have to do an administrative follow-up, and be sure that you have 80%. And we can discuss if there are issues about meeting that minimum, ways that SAMHSA can support your program. Again, a high-level review, again, sections A through G. At discharge, you don't do I, you do J and K. And then if there's difficulty completing the interview, you would do an admin discharge. That's your sections A and then J and K. And again, this is just SAMHSA policy on when you may need to do that administrative discharge. So then screenshot of where the data is reported. And again, you need to have a SAMHSA account in order to report into SPARS. Just going to show you some examples of the kind of reports that you can run. Your GPO can run these as well. So as your program starts to mature, you'd want to start to log in and start looking at the kinds of information your program's collecting. So we have a number of different reports within SPARS. This report here is the NOMS report. So essentially, once you get a certain number of data, you notice on the bottom you have abstinence, crime, and criminal justice, etc. These are your NOMS. And you would want to see, obviously, that bar on the right start to increase. And for good reason. That's showing that you're doing good work. And so this is a way that you can self-monitor your own program in addition to the GPOs using the same information in case they would like to have some further discussions vis-a-vis technical support if you're struggling in any of these NOMS sections. There are also other reports. We have particularly for programs that have populations that are not only dealing with opioid, but you may have a high HIV risk. You can run this report to see the kinds of risky behaviors that your clients are reporting. And again, this is the kind of report you want to run once you're maturing and you've got a large number of 6-month follow-ups completed. This is on abstinence, and the abstinence report breaks down your individual grant program data by the particular substances used. So you have an overall abstinence, and then it gets into specific substances. You might be interested in, are we meeting our population? If you notice that perhaps there are less opioid reported, maybe other substances, that's also information for targeting purposes for your program. There are a number of reports here in addition to the ones mentioned. So as your program gets off to a start, maybe 6, 7, 8 months down the road, you want to start running these reports. You might start with intake, and you also have follow-ups, which I discussed, but there's a demographics report. There's a drug use report. The frequency report. The frequency report is the one that sort of indicates the specific substances being used. There's the 6-month follow-up change report. Many of the reports that were shown fall into this category. And then I also talked about the risky behavior outcome report. You can use these in conjunction with each other or individually to help you support your program and assist with performance monitoring. The report here is some more samples I wanted to provide. On the right, we have recently updated and provided grant programs access to our data visualization reports. These reports, as you can see, it's a little more graphically friendly. It breaks down very intuitively. You have different filters. You can filter by fiscal year. You can look at the outcome change report. You can look at things such as a breakdown of gender. Depending upon how ethnically diverse your program is serving, you can look at there, and you can look at it over time. So I would encourage you to take advantage of the data visualization report once you get your accounts, or if you already have them and you have a lot of data, log on and run through these and play around with it to kind of see how your program's doing. I just want to provide at a high level, I took a look at the TOR program, and this is as of November 1. So I can run this at any time, but I was curious to see, at least at this point, how many are reporting kits and how many have been distributed. So this is just sort of for your edification, at least up until November, about 2,300 or almost 2,400 kits were purchased, and about, maybe less than a quarter were distributed. And we expect, obviously, for that to increase over time. In addition to that, you see the ICD-10 codes. We ran a report and asked for top 5 primary diagnoses. Within SPARS, you can report primary, secondary, and tertiary. But just for expediency's sake, I wanted to look at the top 5 primary diagnoses. And as you can see, your program is, serving the client as advertised. So I just wanted to allow you access to this information. Again, it's at a high level. It's not any particular grant program. It's been identified. But if needed or necessary and you want to know what's going on with your individual program, this is where you can contact your GPO and or myself, and we can get that information to you. Eventually, you will be able to run these programs, run a report yourself. We are currently working on a system report where you can look at the number of kits, if that's what you're doing, and or look at your diagnostic categories that have been reporting into SPARS. So this is kind of a coming event, in other words. I mentioned at the beginning of the presentation that there are a number of resources and trainings that are available for TOR grantees. I highlighted the top 5, including ones you want to take advantage of right away if you haven't already done so. So once you have an account, there are a number of pre-recorded trainings as well as paper resources that you can download in SPARS. You want to start with the first 2 just to kind of get yourself up to speed on the system itself, and then eventually if you want to understand follow-ups or having issues with follow-ups, we have a number of pre-recorded trainings that can support your program on increasing your follow-up rate. And in addition to that, there are advanced follow-up rate techniques that we recently published in SPARS. And then finally, using technology. When we first had SPARS, it used to be the OSACE system. It indicated things like, getting the client's pager number and things like that. Well, times have changed. People have tablets, cell phones, social media. So the last 3 trainings were as a result of changing times. And so once you have your SPARS account, this is where you can find the online learning center, and you can search for the trainings that I indicated earlier, in addition to others that may be of interest. When we're finished, and again, this may be for grant programs that are new or if there's something that has changed, once your account is set up, let's just say you're new to SPARS, we load your basic information into SPARS. SPARS will automatically send you this grantee information sheet. It kind of looks like what you see on your right. And that allows you to verify the information that we have. It also allows you to add any staff that you feel should have access to your specific grantee account. And you'll put in your targets, particularly your targets if you're serving individual clients. And it verifies your GIPR type. In other words, are you a client level? If not, then that's where it stops. So you're only reporting program level data. So it allows us to make sure that we have programmed your program, your grant program into SPARS appropriately. Your project officer will also get a report on what you submitted so that everyone is on the same page and we have true transparency. So again, piggybacking on what I just said, what should happen next after we're completed today is you want to make sure that you have reviewed updated guides, everything related to the ICD-10 codes. You want to look at the frequently asked questions. You want to review the Q by Qs. And again, if that applies to you, you want to also make sure you have discussions with your GPO to discuss any additional support you might need, particularly if you're not familiar or you're new to SPARS or you're new to SAMHSA or you still have questions about the GIPR tool. You should start collecting your data. You don't have to wait. I know from the funding opportunity announcements and SAMHSA policy, we give new grantees about a quarter to start collecting your information. But if that doesn't apply to you, you should begin collecting your information right now. So you don't have to wait, and some grantees are able to hit the ground running and start seeing clients right away. But if you do have any questions or concerns, definitely discuss those with your GPO. If there's issues with the system, you can contact the SPARS help desk. The final bullet, CQI, that's continuous quality improvement, and that's why we have SPARS. So as I mentioned earlier, start running those reports as your program matures. If you're onboarding new staff, if you have turnover, those kinds of things, you want to make sure that they are familiar with the training resources, and you might require retraining as necessary yourself. And then again, seek technical support. And that doesn't have to be one stop. That can be ongoing. What I put here there are a number of practitioner resources on SAMHSA's homepage, that's samhsa.gov. So what I wanted to highlight, or at least and show you that if you're not already familiar, SAMHSA has funded the Technology Transfer Center. You're likely familiar with that. We also have our state targeted response. There are a number of these that are specific to opioid grantees. We also have the rural opioid training technical assistance. And following that, I think on the same page, about the bottom third, there's the tribal training and technical assistance center. So there are a number of resources on the practitioner technical assistance page on the SAMHSA site that you want to take advantage of. And if you're not familiar, again, I would go click on those links and see what kind of resources are that may be important to you that aren't necessarily data, but may impact your data, but they're more on the clinical programmatic side. And if so, your GPO can refer you to these resources as well. So at that time, I'm going to stop and again give time for the conference coordinator to talk about how you want to submit any questions you may have. So I thank you for the opportunity to talk with you all about SPARS and about program monitoring. And that is my information if you want to contact me directly by phone or by email. And if not, then again, thank you for the opportunity to discuss SPARS and performance management.
Thank you so much, Dr. Fulmore. And I'll pull this slide back up in a moment once we get questions going. But for now, I just want to pull up the slide with the instructions. Those of you who have been listening through your computer speakers, we'd like to ask you now to mute your computer speakers. Well, first maybe listen to all these instructions before you start doing them, so you can hear all of it. But you'll see you can mute your computer speakers by clicking on that green icon up at the top. And then next to that, you'll see a phone icon, and you can choose the option of connect my audio. And that should pop up this box that you see to the left that asks how you would like to join the meeting's audio conference. And if you choose dial out, then you can put in your phone number and the conference line will call you. And when you answer your phone, you'll just dial 1 to join. And then you'll be able to listen to the conversation via your phone. And then when you're ready and you have a question that you want to ask, you can use that icon up at the top that is like a raised hand, and then we will identify people one at a time and have them ask their question. For those who called in and have been listening on their phone, if you called the conference line directly, if you can do this option, it will make it a little easier for us to identify those who want to ask a question. But if the other option is you can put your phone number in the chat box, and so we can identify which phone number to unmute, and then we will go about it that way. I think we've got a raised hand here, so I'm gonna take the group off mute, and so there may be hopefully not too much, but we may have a little bit of background noise. If I need to mute people individually at this point, I will, but I'll try this out first here. Just one second. Okay. And so I've got Allison here has raised her hand.
Hi, good afternoon. Thank you for the opinion. Can you hear me?
Yes, who are we speaking to?
Hello? This is Allison Nemes with the Seminole Tribe of Florida.
Thank you so much.
I had a question regarding the SOAR Tour program instrument. So when we reported the last 4 quarters, it asks if you've used the funds to expand the availability of the naloxone, and then if you answer yes, it asks how many kits have you purchased in the last reporting period.
I think you were cut off. I got up until the second, well, not question, a comment about the second question of the program tool. Can you repeat that?
Allison, are you still there with us? Okay, looks like we may have lost, can't hear Allison at this time. So Allison, if you can hear us, if you could just raise your hand again, or chat the rest of your question in the chat box, that would be great. Oh, Allison, are you there? Sorry, Allison, I'm not sure what has happened, but we can't hear you at the moment, so we may go on to the next question. I've got Ray with a question, so Ray, let's see if we can hear you now. Ray, are you there with a question? Okay. I apologize if we're having some difficulties with people trying to get their audio connected.
It might be easier to maybe start with the ones that were in the chat, and then we can kind of go through those and then maybe get back to the audio.
Okay, great. Darren and Amy, I actually just emailed you a quick summary of the questions that we had gotten.
Is there a, if we just start at the,
Okay, we will start with a question about the naloxone kits. This question is from Kelly Jarvis. With regard to the naloxone kits, how would you like these counted? They typically come in 2 doses per package. Would you count each dose as a kit or one 2-dose packet as one kit?
I would, one kit. And I would read the question literally.
Okay, so one kit. The next question is from Heather Summers. Is there an option to report all of the first year on one report for naloxone instead of quarterly?
The system is going to ask by quarter because sometimes we do get questions about what have we done. For example, we're in the first quarter of 2020, so it's just a more accurate way of collecting the information. In addition to that, eventually the system is going to only allow people to enter information during that reporting period. Right now, because of our late start with the SOAR and TOR, we're allowing people to go back and enter their information. Eventually, that won't be the case.
Our next question is from a grantee in Oklahoma. Will GPOs change again? If so, could we be contacted with that change? And I can respond to that. Well, yes, Oklahoma, currently I have Oklahoma, but the new GPO will be taking Oklahoma when that person is hired. And we will notify grantees in those regions, Region 5 and Region 6, that they will have a new GPO. And we will make sure to transition all of the conversations and all of the work that we have to that new GPO. The next question is from Amber. Do we have an official start date for data process?
You can start entering information the day you are awarded. So there are some grant programs that can hit the ground running. There are some grant programs, as SAMHSA allows for new grants, a quarter to really get themselves up to speed, hiring staff, that kind of thing. So there isn't the official start date is your funding start date, essentially your period of performance. But we understand for new grant programs, it's very rare for them to be able to start seeing clients day one. But there are exceptions.
Hello?
Yes, we can hear you.
Okay, this is Colby from the Northwest Portland Area Indian Health Board. So I know you're going through questions, but I have a follow-up question to that. That's not talking about grantees from last year that started. So we weren't supposed to start data collection when we got our NOA last year. So that doesn't work for us. When are we supposed to start? Because supposedly an email went out, but many of us did not receive that email, and our GPOs also did not notify us over months that we were supposed to start data collection. So can we please receive a start date on this call so that we know when we're supposed to start?
So your start date, assuming you don't have the capacity for getting your information prior to the date, would be 11/22/2019. So you can enter your data in today.
Okay, thank you. And I just want to make sure, Amy, is that the SAMHSA and the Office of Tribal Affairs understand that a lot of us did not receive that email in the summer, so we're going to start as of November 22nd.
Correct.
Thank you.
And this is a follow-up to Colby. So if you have the capacity, and we've had this conversation before, to provide any information prior to the day, that is not something we would not allow. But I know you wanted to have a start date, for lack of a better term. So I'm just letting you know that the system isn't going to prevent that.
Thank you.
Okay, so it seems like the audio is fixed now, so we can take the next question.
Are there any other audio questions?
If nobody else has one, this is Colby from the Health Board again. I have another one.
Okay, go ahead, Colby.
Okay, so based on our conversation earlier this week, we talked about recovery services and when you have to collect GIPRA for recovery services. So we have a few of our tribes in our consortium that are incentivizing people to go into treatment by incentivizing their recovery housing. So they are going to assist with paying very small amounts for their recovery housing. And we don't know if that recovery housing is attached to a specific tribal MAT program. Sometimes it's a county program, and then the recovery house is not always connected to that county recovery program or treatment program. So my question is in these instances for the tribes when recovery housing is not always linked directly to the treatment, can we somehow receive some sort of bypass, or can we talk specifically to our GPOs about that when it's also a small amount of money, because we can't confirm that the county or the contracted group of folks or whoever will actually do GIPRA for us for such a small amount of money for incentivizing. So we have some people, we have got one that's going to pay for recovery housing up to a certain amount of money, and then we have another that's incentivizing by saying each time you go to treatment or something, you'll receive a $30 gas card or a $30 Walmart or whatever card. So it's just showing like, thank you for trying, thank you for going, and just collecting data on all those things when it's not their MAT program is just not something that we see being feasible.
Okay, well, thank you for your question, Colby. So every individual client level service has to be captured through with the GIPRA tool. So if you're doing individual recovery sessions, then yes, you do need a GIPRA tool. If you are just providing maybe incentives to that person, then no. Something that is not an individual session does not require GIPRA. If you're doing a group session and that person is only getting a group session, then GIPRAs are not required. But if you're providing individual case management, individual type of services to that person, then a GIPRA, it is required. So I think each program needs to assess that individually, the type, because you all provide different types of services, and see which ones would you like to collect GIPRA and will make sense on an individual basis.
Okay, thank you. So there might just be one that I'll talk to you about another time, because right now I haven't gotten a clear answer what it is, so I'll bring it to you when we find that out. Thank you.
Okay, the next question is from Danielle, and I think your question was more for the group, and maybe you could get responses via chat. The question is, has anyone been getting a lot of resistance from the client when filling out the tool? And I think that's not a question really for us, but it's for other grantees. The next question is from Anna. What if our clinic's discharge policy, 90 days inactivity, does not match SAMHSA's 30-day inactivity discharge?
So again, this is Darren. You would follow the tool as indicated. So if you aren't able to reach the client after 30 days, you would complete an administrative discharge, and that would be sections A and J and K. So just to be consistent so that we don't change it by grantee, please follow the SAMHSA policy on inactivity. And again, if there are concerns about this, this is where you can take advantage of either the follow-up resources that we have, and or if it's something that's more on the programmatic or clinical side, make use of those resources that were provided at the end of the presentation.
The next question is from Arlen. Do you have to be a licensed person or certified person that specializes in chemical dependency or mental health to give a diagnosis to report?
SAMHSA doesn't provide or indicate guidance on the credentialing or certification of the providers that are hired or clinicians that are hired by grantees. So I would refer you to what your jurisdiction indicates vis-a-vis what specializations should be used for providing this kind of clinical support.
The next question is from Kelly. SAMHSA used to offer in-person regional trainings for the client-level GIPRA interview. I have been told that these in-person meetings have been replaced with online trainings. Can you point us where these trainings are and ensure that they are accessible by staff without a sparse login?
And on the slide deck, you do need to have a SAMHSA account to access SAMHSA's training. There are some resources, so let's just say you're the project director. None of the resources that are there can be downloaded and shared. There are tools, depending upon your bandwidth. I think some of the pre-recorded webinars, you may be able to download those as well. However, you may not see those if you don't have a SPARS account. So there are a number of questions about, are you able to see these trainings without a SPARS account? That answer is no.
Next question is from Gina. Is there a 3-month follow-up required?
No, there's only baseline, 6 months, and the discharge.
The next question is from Heather. If we previously submitted a grantee information form, do we need to complete another one?
No, you do not. If there's some information about your program that is missing, again, mentioning some of those reports in SPARS, you could run your own information. It's like an administrative report. You can run it and see what's in there about your program. If you've been submitting any kind of GIPRA data, you can run a report on your intakes or follow-up, and you will see whether or not we have any target information for you or something like that is missing. Your GPO can do this as well. So a lot of the same information that you're being provided is also being provided to your GPOs, because they're all going to be going in and looking in to see what information we have on all the various.
Okay. The next question is from Amber. For client-level data we're capturing in electronic health records, can it be batch entered via the identified report rather than entered live time?
So I mentioned earlier, for any grantees that have the capacity for doing batch uploading, the SPARS help desk as a team that I can put you in contact with, and there's sort of a credentialing process, certification process. Once that's set up, you can do the batch uploading, assuming you have that capacity, and you provide your own client IDs. So if you de-identify your clients using your own specialized client ID, that's how you'll be able to know who you're entering into the system. So I hope that answers the question. But in order to do batch uploading, we need to put you in touch with the SPARS teams that specializes in that.
Okay, and Alison Nemes asked a question, and we couldn't hear her, but we have her question on the chat. On the SORTOR reporting program instrument, the question 1A asks how many kits have been purchased since the last reporting period. If we do not purchase any more kits, we're blocked off from reporting 1B. However, we had purchased kits in the fiscal year, in FY19 Q4, and have given away kits in FY20. I think there's a typo there. I believe like she had purchased the kits in I'm not sure if I understand the question, and would like to report on these.
So when you go into SPARS, you can report for fiscal year 19, the last quarter, so I assume that would be July through September, and you would answer the 3 questions. If when it's time to enter Q1 fiscal 2020, I'm just going to assume that's what you're referring to, then January, no, that would be 10/1 through 10/30. So you would click the tab for that quarter and enter your information. So essentially, there are interviews, separate interviews for each quarter that you're entering your data.
Okay, the next question is from Patricia. When entering data into SPARS and you get called away and the system automatically logs you out, will the data be saved, and after logging in again, can you just continue where you left off, or do you have to start over?
You have to start over, and this is more of an artifact of the type of data that's being entered because it's very sensitive, and also because SPARS is programmed into SAMHSA's cloud system, which falls under a number of regulations about security. So if you walk away and someone comes in, and I'm not saying that would happen, but could potentially lead to a security hole through SPARS, using SPARS as a way of getting not only into SPARS data, but the rest of SAMHSA's cloud. So it will term out. So what we recommend is that if you are about to enter information, be sure you have enough time set aside to complete the interview. We are working towards adding a feature where you may be able to save this information. That is not there now, but that is something that I know has been recommended.
The next question is from Ray. Can we get approval to conduct the GIPRAs via telephone due to our case manager being in Anchorage and the remoteness of our clinics?
Right, and that is one of those where you would work out an arrangement with your project officer. So we understand there are cases because of remoteness or rural grantees that have clients in very rural areas. So SAMHSA discourages doing the intake this way, but we understand that when exceptions need to be made, you'd want to have an in-writing permission from your project officer.
Okay, I think Amber needs clarification on the GIPRA data collection start date. She's asking, can start and required start date are different? Do we have an official start date?
I think I mentioned earlier that your official start date is your period of performance. If you're a new program, SAMHSA gives the new grantee about 4 months, but there are grant programs that can hit the ground running. For programs that have at least been a year, I assume they're cohort 1, I think I answered, I think it was Kobe, that question, that you can use this discussion, this webinar as your official start. Well, your official start date would have been when you were funded, but I assume you mean entering information. You'd want to start entering your information in now if you have it. So that's not something you need to wait.
Okay,
Right.
Kate, are there any other additional?
And I wanted to clarify. So there, we had some discussions over the summer about when the tool was updated, and we added in the ICD-10 codes and things like that. So you'd want to use June 1 as sort of a date to, not sort of, use that as your date to really start collecting your information if you are cohort 1. Your cohort 2, your period of performance started 10/1/2019. Your cohort 1, June 1, 2019. Another question.
Okay, the next question. Okay, this is from Kristen. So if the inactive client was discharged, but let's say came back after 60 days, would we use the original GIPRA, or would they get a new one if they were an admin discharge?
When the client is discharged, you would do the tool again. And we understand, because of the population that you're serving, that they may get many episodes of care. The key thing is to make sure your client ID is the same. And the way SAMHSA counts your information is we use your most recent episode of care.
Okay, the next question is from Paulette. If we did not specify in our grant to provide naloxone kits as part of our project plans, but want to sometime in the upcoming year, do we need to do a change of the scope to include this?
if it's something a little bit different, this is Nicole Cleveland, the Grants Management Specialist. If it's a change of scope, you would need to provide a narrative with an explanation, certainly the cost, anything that's going to be supportive of the program, and I would work with your project officer and see how the funding is going to be affected. But you would need to be able to provide as much detail and documentation as possible. It shouldn't be a problem, just as long as you provide a narrative with an explanation of how it's supposed to be supportive of the program. It shouldn't be an issue. We just need the documentation. But that's my working with your project officer as well.
Okay, just to be clear, yes, you do need a change of scope and a new budget for.
Thank you kindly.
Just wanted to make sure that that is clear. Yeah, and then Joanne.
Yes.
Okay, you can also use your supplemental funding for naloxone if that's
with the
something you would
purchase
like
of
to do.
additional medications or anything that's going to be supportive of the initial program and using your supplement funds.
Okay, I think Joanne needs a clarification on the previous question about naloxone kits. If you bought in one quarter and used in another quarter, how do you report that? And that's regarding the naloxone kits.
So you try to do it as accurate as possible. So if you purchase kits, let's say we're in quarter one, you indicate we intend and we distributed 0. Then the next quarter, you'd want to actually report how many you distributed. So you want to be as accurate to the questions. 3 questions. Do you intend on using it? Yes. Did you buy any? Yes. How many did you distribute? So you want to, if you didn't distribute that quarter, you would put 0. The next quarter, you would say yes. Did you buy any? No. But did you distribute? Yes. So you want to be as close to how the intention of the question as possible. And if there are issues with the technology or things like that, you can contact SPAR's help desk. Because we do understand that you might purchase your kits all at once and distribute them over the course of the year. So it depends on how you purchase them.
Okay, and I think Joanne has a question about that. Kate, could we unmute Joanne's line?
Yes, Joanne, are you there?
Joanne Lee.
Hi, this is Joanne, and I think this is coming out on the chat too. It sounds like the tool blocks you if you don't buy any that quarter, so you can't report the distribution. So we need clarification or need that part fixed.
Okay, and this will be something where I can send an email to the SPAR's help desk, and that could be something that wouldn't be that big of an issue to change, but thank you.
Okay, thank you.
Do we have any questions, Kate?
I've got Colby. Yes, Colby, hopefully you can.
I think we have another question
hear you
from
now?
Colby.
Yes, hello. I just wanted to ask, I put it in the chat a few times, but I think there's so many things going on, it's tough. In the presentation, it said that you have to do the GIPR data by interview, but this week over the phone, I was told that it's okay if it's done by chart review. So I don't really know which one we should be doing.
What we were discussing is that there are some grants that they do have some client information, and we understand it would be impossible to go back and re-interview a client 6 months ago, but you have some information that you can enter into SPARS based upon what you have in your chart. So that way we can show that you are indeed providing services at the client level previously, and that's what we meant by chart review. Moving forward, you'd want to do obviously you'd want to have your interviews and complete all the information that you can get with the client there or within a week of completing the interview.
So I was talking about a call like earlier this week, so not on this one. So to clarify real quick, I was told earlier this week that you can do it by chart review, and you're saying from the start of from the intake interview on, you should be doing it by interview, and your 6 months follow-up, potentially some of it can be done by chart review. But your first interview or your first GIPRA tool data collection should not be through chart review.
So if you have information on your client, and again, I'm talking retrospectively, and also you may have, and I think we were also saying whatever resources you have, so we're not changing your business operations, that collects the information that in the tool, you can use that. So we're not trying to change how you are doing your day-to-day business. So that might be what you're referring to, and especially with respect to clients you may have served obviously prior to this call or back through the summer. So when we're talking about chart review, it is okay in order for you not to have major disruptions in how you conduct your business in terms of client care and collecting your information.
So I don't think we're quite on the same page with what I'm asking, so I'll double back another time and talk with Amy about it. Thank you.
Okay.
All right, Joanne. Joanne, are you there? Can we hear you now? Is this Joanne?
Hello?
Did you have another question, or?
Yes, this is. I'm sorry.
Okay, speak a little bit louder. We hear you.
So I had talked to my GPO previously. They have 2 clients that were enrolled prior to the GIPRA tool being approved, and I was one of the programs that did not get a notification that the GIPRA was approved. So they never got the initial evaluation, and then I was told that we did not need to collect GIPRA data on those 2 clients.
Can you repeat that one more time?
So I have a couple of clients, so that if they started now would need to be getting the GIPRA level data collection, but they started before the GIPRA tool was approved. So we didn't have a tool to use when they first enrolled in the program, and so what I was told when I brought this up on the recent telephone interview with the program specific was that I shouldn't collect any GIPRA data on them. Because I don't
correct.
Have the initial.
Yes, that is correct. The GIPRA tool was approved on June 24th, so all data collection for TOR Cohort 1 should have started on June 24th, and we understand that the communication wasn't very clear, but some programs did start collecting data on June 24th, so for those of you who have started on that day, that's fine. That's when the tool was approved. For clients that started prior June 24th, then you are not collecting GIPRA.
Okay. All right, and okay, I just wanted to make sure. Thank you.
Okay, then we have another question from Veronica Sanchez. If we don't purchase naloxone because we're collaborating with a state entity who is providing, but we distribute, can we report on a SPARS? So they're use funding through not TOR, but they are distributing through TOR.
Mm-hmm. Right. So if the state is purchasing, what should happen is the state should report that in the SPARS if that's a SAMHSA fund, but through the SOAR as opposed to TOR. So that might involve some collaboration between your program and the SOAR program to say, thanks for purchasing the kits. We've distributed this many. Make sure that you indicate that.
Yeah, and I think that answers a couple of questions that we had that were similar. Okay, do we have any other questions? You could use the raise your hand feature to let us know if you have a question that has not been addressed today. Or you can type your question on the chat as well if you would like.
It looks like Joanne is raising her hand. Kate, can you unmute her?
Sorry, I believe Joanne should still be unmuted if you have another question yet.
Okay, in the meantime, there is a question, clarification for the Narcan distribution on how do we report if we are distributing Narcan but not purchasing the Narcan. Then you can do that on your annual progress report. You can let us know that you are distributing and you could give us the amount, but you can not report that on the program GIPRA tool. We will be providing the updated presentation via email, and this webinar has been also recorded, and we will be providing everyone with the recording of the webinar in case someone needs clarification or needs to listen to it again. Okay, we have about 4 more minutes. Any last minute questions? Okay. For any specific questions, please contact your GPO. I know there are a lot of very specific situations, and we will work with each program on those specific cases. Okay.
All right. Well, thank you, everybody, for joining our call today. Congratulations on the new tour grantees. We look forward to seeing your activities and what you accomplish in your programs, and we'll be looking forward to the first cohort, fiscal year 18 tour grantees, and receiving their final end-of-year reports to find out what activities and what accomplishments you have done with your funding. I want to thank our CBISC team, Darren Fulmore and Gwendolyn Cleveland, Nicole Cleveland, sorry, and Amy Romero for participating, and of course our Technology Transfer Center for supporting this call. At this point, we'll conclude the call, and thank you once again for joining us